say this. The Cajun Dome makes me make this announcement. You see over all the doors where it says the exits? Okay, if there is a fire, go to one of the exits, but wait till I've gotten out of the room first, okay? And then y'all come out after me. That's supposed to be a joke. Anyway, here we go. Now, here's how we do it. I do not read the questions to you because then I emphasize the right answer, okay? So you just read the question. I'm going to put up 4 answers for you. Then discuss it with your friend and y'all figure out what you think the answer is. You like this one, don't you? You hope you get this one on your test, don't you? Because what's the answer? 4. You don't do what you've seen them do at the hospital. Because what they've done at the hospital is they turn the alarm off first, then they look at the patient. You see, when you have a situation like that, you always put the patient before the machine, right? Answer? 3. You've got somebody with chronic lung disease, so you look at number 1 and say, I haven't memorized all those percentages of oxygen, but that just seems like it might be too much, right? You don't give too much oxygen to COPD patients, and I don't recommend you go and memorize all the different percentages of oxygen and that sort of thing. And then look at number 2. Well, if you're already severely dyspneic and purple, you really don't feel like coughing and deep breathing right now, right? Right. And then what do you think about saying to somebody, roll over, I got to check your lungs? Number 4, I don't think so. When you're purple, you really don't feel like rolling over. Now, do you? Tell your friend what you think the answer is. Now tell me. Number 1. Number 2, sandbag it. I don't think so. You're not going to totally occlude the site anyway, okay? That's with fractured ribs that you have to immobilize the ribs so they won't keep rubbing so much against each other. Number 3, I don't think with this patient we need to sit them up because it's a trauma patient. And then number 4, I don't like the word what? Airtight, because that's going to promote a what? Mediastinal shift. Now, a lot of people look at number 1 and say they are not going to have a sterile dressing, so that can't be right. If it's in the answer, you've got it, okay? Don't ask yourself questions like that. Now read that and tell your friend what you're supposed to be worried about. What are they painting you a picture of? Pulmonary embolus, right? So what should the answer be out of these four? Number one. Y'all, if somebody's got a pulmonary embolus and they're in this bad a shape right now, are you going to try to suction them? That's going to put them out of their misery, right? Right. Number three, what do you think about that? Not smart, right? It doesn't even go. That's when somebody's in shock. You put them flat with their legs up, modified Trendelenburg, and if you selected number four, what did you just turn into? A doctor just like that. You do something simple. Out of the four options, that's the one you have to pick. Answer. You like that one, don't you? You are going to scare the patient to death if you go in the room and start pumping on their chest, right? Right. Y'all, when somebody's tube has come out, will increasing the fluids do anything? It won't help anything to do with the tube coming out. Answer? What do you think about number one? Normal, right? Yes, as expected. What do you think about number three? If you're 2 hours post-op, don't you think that's a little early to be rolling people over? Yes, you don't worry about contractures 2 hours post-op. See, that's what they're doing by putting them prone. They're worried about contractures. Now, what is the patient going to do to you if you start doing number four? Kick you with the only leg they have left, right? Now let me tell you something. When you pick your answer here, be sure and think, is there anything